Over 60. Dizzy when you stand up could be a warning before a fall. Have you ever stood up from bed or a chair and suddenly felt the room move? Maybe your vision became dark for a few seconds. Your knees felt weak. You reached for the wall or grabbed the nearest piece of furniture until the feeling passed. Many adults over 60 describe this experience with one simple sentence: "I just stood up too fast." Sometimes that may be true. But recurring dizziness when standing should not automatically be dismissed as a harmless part of aging. Those few unsteady seconds can be the moment before a serious fall. And for an older adult, one fall may lead to a broken hip, a hospital stay, weeks of rehabilitation, or lasting fear of walking alone. Let me tell you about a man we will call Robert. Robert was 72 years old and lived by himself. He still drove to the grocery store, prepared his own meals, cared for a small garden, and walked around his neighborhood most mornings. His children often asked whether he needed more help. Robert always answered the same way: "I'm fine. I can still take care of myself." Then his doctor increased the dose of one of his blood pressure medicines. A few days later, Robert began feeling slightly elated when he got out of bed. The sensation lasted only a few seconds, so he ignored it. One morning, he woke up needing to use the bathroom. He stood immediately. His vision dimmed, his legs weakened. Before he could reach the wall, he struck a small table and fell to the floor. The fall took only seconds, but it changed the way Robert lived for weeks. He did not break his hip, but he injured his shoulder and badly bruised his side. After that, he stopped walking outside alone. He became nervous in the shower. At night, he worried about getting out of bed. For the first time, Robert wondered whether he could continue living independently. Later, his medical team discovered that several factors had come together. His medication dose had recently been increased. He was also taking a diuretic, often called a water pill. He had been drinking less because he did not want to wake up to use the bathroom. On some nights, he used an over-the-counter sleep aid. No single factor fully explained the fall. Together, however, they created a dangerous situation. In this video, we will examine 7 common blood pressure medication mistakes that may increase dizziness and fall risk in older adults. You will also learn how to get out of bed more safely, how to measure your blood pressure correctly at home, and when dizziness, fainting, or a fall needs medical attention. This video is for education only. It cannot diagnose the cause of dizziness or replace advice from your doctor or pharmacist. Never stop, skip, double, or change a prescribed medicine on your own. Mistake number 1 is assuming that dizziness when standing is simply normal aging. When you are lying down, blood circulates through your body without having to work against gravity. In the same way, the moment you stand, gravity pulls some blood toward your legs and lower body. Your nervous system normally responds quickly. Your blood vessels tighten, your heart adjusts, and blood continues reaching your brain. As people get older, this response may become slower. Some medical conditions and medications may slow it even further. If your blood pressure falls too much after you stand, you may feel elated, weak, unsteady, confused, or close to fainting. Your vision may become blurry or dark around the edges. Doctors often call this orthostatic hypotension or postural hypotension. In simple terms, it means that blood pressure drops when your body moves into a standing position. The feeling may last only a few seconds, but you do not need to remain dizzy for several minutes to fall. 2 or 3 seconds may be enough, especially in a dark bedroom beside a staircase or on a wet bathroom floor. Pay attention to when the dizziness appears. Does it happen immediately after standing? Does it improve when you sit or lie down again? Is it worse first thing in the morning? Does it happen after a hot shower, a large meal, exercise, or time spent outdoors in warm weather? Did it begin after a new medication or a change in dose? These details can help your healthcare provider understand the pattern. At the same time, not every dizzy spell is caused by blood pressure medicine. Problems with the inner ear can create a spinning sensation. Low blood sugar, anemia, dehydration, infection, abnormal heart rhythms, vision problems, and neurological conditions may also cause dizziness or poor balance. That is why recurring symptoms should be evaluated instead of explained away as age. Mistake number 2 is stopping, skipping, or changing your medicine without medical guidance. After a dizzy spell, some people immediately decide that their blood pressure medicine must be too strong. They skip the next tablet, they cut the dose in half, they begin taking the medicine only on days when their home reading looks high. Others stop completely. This may create large swings in blood pressure. It may also make it harder for your doctor to understand what is causing the problem. Blood pressure medicine is usually meant to be taken consistently. High blood pressure often causes no clear symptoms. So feeling normal does not mean your pressure is under control. Dizziness should begin a conversation with your healthcare provider. It should not begin a personal medication experiment. Your doctor may decide that the dose needs adjustment. The medicine may need to be taken at a different time. One drug may need to be replaced with another. Blood tests may be necessary, or the dizziness may have another cause. The safest approach is to collect useful information. Write down when the dizziness happened, how long it lasted, what you were doing, and what medicines you had taken during the previous several hours. Bring a complete medication list to your appointment. Include prescriptions, over-the-counter products, sleep aids, allergy medicines, pain relievers, vitamins, and herbal supplements. Your doctor and pharmacist need to see the entire picture. Mistake number 3 is failing to pay special attention after starting a medicine or increasing the dose. This is a critical period. A medicine that you have taken comfortably for several years is different from one you started 3 days ago. The same is true after a dose increase. Your body may need time to adjust. The risk may be higher when 2 or more medicines are changed close together. When you begin a new prescription, write down the date. If the dose changes, record the old dose, the new dose, and the day you started taking it. During the following days, notice whether you develop a new pattern of light, aidedness, weakness, blurred vision, near fainting, or unsteady walking. This does not mean you should expect a dangerous reaction. It means you should notice changes before they lead to a fall. The next mistake is especially important because it can happen even when your prescription has not changed. Your body may change. A dose that worked well 6 months ago may affect you differently after weight loss, a hospital stay, reduced appetite, kidney problems, prolonged bed rest, or new illness. Blood pressure treatment should be reviewed as your health changes. It should not be placed on autopilot forever. Mistake number 4 is underestimating dehydration. Many older adults intentionally drink less. Some are tired of frequent bathroom trips. Others worry about bladder leakage or waking several times during the night. Some simply do not feel thirsty as strongly as they once did. Then something changes. The weather becomes hot. They develop a fever. They have diarrhea or vomiting. Their appetite falls. They spend a long day outside or in a warm room. Their body loses fluid, but their usual medication routine continues. Diuretics add another factor. These medicines help the body remove excess salt and water through urine. They are useful for treating high blood pressure, swelling, heart failure, and other conditions. But in some people, a diuretic combined with poor fluid intake, heat, or illness can contribute to weakness and low blood pressure. This does not mean everyone should suddenly drink large amounts of water. Some people with heart failure, kidney disease, or low blood sodium have been told to limit fluids. Their safe intake may be very different from someone else's. Ask your healthcare provider how much fluid is appropriate for you. Also, ask what you should do with your medicines if you are unable to eat or drink normally because of vomiting, diarrhea, fever, or another illness. It is better to know the plan before you become weak and dizzy. Possible signs of dehydration include a dry mouth, darker urine, urinating less often, unusual fatigue, weakness, and worsening light-aidedness. Do not ignore these signs simply because you are still able to walk around the house. Mistake number 5 is overlooking the combined effects of several medicines. Many falls are not caused by one medication acting alone. They happen when several medicines affect blood pressure, alertness, reaction time, coordination, or balance at the same time. Imagine taking a blood pressure medicine that causes mild lightheadedness. You also take a diuretic that increases fluid loss. At night, you use a sleep aid that makes you drowsy. Then you wake at 2 in the morning and rush to the bathroom. Your blood pressure may be slow to adjust. The room is dark. Your legs are stiff. Your reaction time is reduced. That combination can be far more dangerous than any one factor by itself. Prescription sleep medicines are not the only concern. Some over-the-counter nighttime products contain sedating antihistamines. These may cause drowsiness, confusion, blurred vision, or poor balance, particularly in older adults. Medicines for anxiety, depression, pain, allergies, bladder symptoms, or muscle spasms may also contribute to dizziness or sedation. Alcohol may add to these effects. Even occasional medicines matter. A sleep aid used only twice a week still matters if your dizziness happens on those nights. A pain medicine taken after guarding still matters if you feel weak when you stand later that evening after a fall, near fall, or recurring dizziness. Ask your pharmacist a direct question. Could any of my medicines when taken together increase my risk of dizziness or falling? Do not ask only about your blood pressure medicine, ask about the complete combination. And now, we come to the mistake that many seniors make every morning and every night. Mistake number 6 is standing before your body is ready. When the alarm rings or your bladder feels full, it is natural to move quickly. You may roll out of bed, put your feet on the floor, and begin walking almost immediately. A safer routine takes less than 1 minute. When you first wake up, remain lying down briefly. Move your ankles up and down, point your toes away from you, then pull them back toward you. Open and close your hands. If it is comfortable, bend and straighten your knees a few times. These small movements activate the muscles in your legs and help your circulation adjust. Next, roll onto your side. Use your arms to push yourself into a seated position. Sit on the edge of the bed with both feet on the floor. Do not stand yet. Take several normal breaths. Move your ankles again or gently march your feet in place. Notice how you feel. If you are already dizzy while sitting, remain seated. Do not stand simply to test whether the feeling becomes worse. When you feel steady, place your hands on a stable surface or use your prescribed walking aid. Stand slowly, then pause again before taking your first step. The second pause is important. Some people feel fine while sitting, but become lightheaded several seconds after they stand. If dizziness appears, sit or lie down again as safely as possible. Do not try to push through it. Do not continue walking toward the bathroom while your vision is dimming. Your goal is not to prove that you can stand quickly. Your goal is to remain independent by standing safely. Look around the area beside your bed. Remove loose rugs, shoes, electrical cords, small tables, and bags that could become obstacles. Use a nightlight or motion-activated light on the path to the bathroom. Do not depend on a table with wheels, a loose towel rack, or unstable furniture for support. A properly installed grab bar, handrail, sturdy chair, cane, or walker is safer. Use the same slow-staged approach when getting up from a sofa, dining chair, car seat, toilet, or bathtub. Pause between positions. That short pause may prevent a life-changing fall. Mistake number 7 is trusting one blood pressure, reading or measuring it incorrectly. Blood pressure is not a fixed number. It changes throughout the day with movement, stress, pain, meals, temperature, sleep, hydration, exercise, and medication timing. A single reading shows only one moment. Suppose your pressure is high immediately after climbing stairs, rushing across the room, or arguing on the telephone. That number may not represent your usual resting blood pressure. On the other hand, one normal seated reading does not explain why you feel close to fainting every time you stand. Correct technique matter. Before taking a standard seated measurement, avoid exercise, smoking, and caffeinated drinks for about 30 minutes. Empty your bladder if necessary. Sit quietly for approximately 5 minutes. Use a chair that supports your back. Keep both feet flat on the floor. Do not cross your legs. Place the cuff on your bare upper arm, not over a sleeve. Support your arm so that the cuff is approximately level with your heart. Use an upper arm monitor with a cuff that fits correctly. A cuff that is too small or too large may give an inaccurate result. Do not talk, text, or watch upsetting news while the monitor is working. Take 2 readings about 1 minute apart and record both. Your doctor may ask you to measure in the morning and evening for several days. The pattern and average are usually more informative than one isolated number. Record the time, your blood pressure, your pulse, when you took your medicines, and whether you felt dizzy or weak. If your doctor is evaluating possible orthostatic hypotension, they may compare your blood pressure while lying down with readings after you stand. Because standing can cause fainting, Someone with severe dizziness or a history of falls should not perform this type of test alone without medical guidance. A commonly used clinical definition is a drop of at least 20 points in the top number or 10 points in the bottom number within 3 minutes of standing. But do not become so focused on the numbers that you ignore the symptom. The everyday warning sign is simple. Your blood pressure drops after standing and you feel weak, unsteady, confused, or close to fainting. One test may be normal even when a real problem exists. The change can vary with hydration, meals, temperature, illness, and medication timing. Repeated observations are more useful than one isolated measurement. Bring your home monitor to a medical appointment from time to time. Ask the staff to compare it with their equipment and confirm that you are using it correctly. So, when should dizziness receive medical attention? Recurring dizziness when standing should be discussed with your healthcare provider, especially if it started after a medication change is becoming more frequent or interferes with normal walking. Do not wait for an actual fall. Contact your healthcare team promptly. If you repeatedly feel close to fainting, notice very low readings with symptoms, or no longer feel safe getting out of bed or walking alone, actual fainting should be medically evaluated because the cause may not be a simple blood pressure drop. Seek urgent or emergency help if dizziness or fainting occurs with chest pain, difficulty breathing, a fast or irregular heartbeat, a severe headache, new weakness or numbness, facial drooping, difficulty speaking, confusion, or a sudden change in vision. A fall may also require emergency care if you hit your head, cannot stand, have severe pain, significant bleeding, or a possible broken bone, black or bloody stools, vomiting blood, persistent vomiting, severe diarrhea, or signs of serious dehydration also need prompt attention. If someone loses consciousness and does not quickly recover, call emergency services. Do not drive yourself while dizzy, confused, weak, or close to fainting. Now, let us return to Robert. His doctor did not simply tell him to stop all his blood pressure medicine. His medical team reviewed every prescription, his diuretic, the over-the-counter sleep aid, his fluid intake, and the timing of his symptoms. They adjusted his treatment and helped him create a safer hydration plan. They also advised him to avoid the nighttime product he had been using unless it was specifically approved. Robert placed nightlights between his bedroom and bathroom. He removed the loose rug beside his bed. Every morning, he moved his ankles, sat at the edge of the bed, and waited until he felt steady before standing. He began keeping a simple record of his blood pressure and symptoms. Within several weeks, his confidence began to return. He started walking outside again. He returned to the grocery store and resumed caring for his garden. The most important result was not only that his dizziness improved, it was that he stopped believing one fall had to take away his independence. The lesson is not that blood pressure medicine is bad. Controlling high blood pressure can help protect the heart, brain, kidneys, and blood vessels. For many adults, medication is an essential part of that protection. The lesson is that treatment must be reviewed as your health, medications, and daily life change. Remember these 7 mistakes. Do not dismiss recurring dizziness as normal aging. Do not change medication on your own. Pay closer attention after starting a medicine or increasing a dose. Do not underestimate dehydration, heat, or illness. Review the combined effects of all your medicines. Stand in stages instead of rushing. And never let one poorly measured reading tell the entire story. Tonight, clear the path between your bed and bathroom. Tomorrow morning, move your feet, sit at the edge of the bed, and give your body a few extra seconds before standing.